Welcome to this edition of Connections. I'm Christy Naus with the Community Foundation, and you know I love to help you know more about what our amazing nonprofit sector is doing around Greater Des Moines. And today we have just that, an amazing nonprofit organization called Primary Healthcare, and I'm with their CEO, Kelly Huntsman. Kelly, thank you for joining us.
You're welcome.
Thank you for helping our community learn more about the organization that you love, Primary Healthcare. Tell us more about Primary Healthcare and what your mission is and who you serve.
Absolutely. So Primary Healthcare is a federally qualified health center. We've been in the community since 1981. We provide medical, dental, behavioral health, substance use services for low-income, vulnerable populations. We run a homeless support program. We do centralized intake for Polk County.
Which is for homelessness.
Yeah,
centralized
homelessness.
intake for
Thank you.
Yeah.
We run a Ryan White program, which helps folks who are impacted or at risk for HIV or AIDS. Really, our mission is to serve vulnerable patients in our communities. We serve Polk, Marshall, and Story County. And we help remove barriers. So we have lots of wraparound services like translation, transportation, community health workers. We help people get on Medicaid and entitlements. So we try to remove the barriers that patients have when they're experiencing the need for health care so that they can actually access health care.
Such important work. You are the safety net for
Yes.
people who need health care
Yes.
and can't get it anywhere else,
Yes.
or haven't gotten it anywhere else, right?
Yes.
And OB and prenatal care as well.
OB, prenatal care, family practice. OB is a real issue for us right now. There's just lots of needs around that in the community, so definitely a big need.
Wow. How many patients do you serve a year, and how many are on staff? How many clinics?
Yep, so we serve about 40,000 people.
Wow.
That's patients, provided about 130,000 patient encounters this last year. So we have, in Des Moines, we have 5 medical clinics and 2 dental clinics. We have 3 school-based clinics also.
Yeah.
And then we have a clinic in Marshalltown where we have medical and dental, and then we have a clinic in Ames, which also has medical and dental.
Yeah. I think one of the first times I met you was years ago when the very first dental clinic was opening over on the east side. And I
Yes.
think perhaps the Community Foundation gave a grant or something
I
to
believe
that.
you did.
And that's one of the reasons we're here too is we recently were able to award one of our leadership grants to your University Avenue Medical Center, which is where we are today. And tell us more about how that really built capacity for you to be able to see more patients and just in a much more humane way, in a way that they should be served.
Absolutely. So the University Clinic is one that is centrally located in probably our highest need area.
Sure.
And so this little 9 exam room clinic was trying to service all of those needs, and we were just not doing justice to the patients and their needs. So we expanded the clinic with funding from you and from HRSA. So we got some federal funding to expand it and got a leadership grant from the Community Foundation. And so the project is complete, actually. And really our plans here are we've added a part-time provider that will help to see more patients. And as the patients present and as we're able to financially add clinicians, support it, we have the ability to add up to a total of 3 additional providers.
Yeah.
So
you certainly need it.
yes, we do.
Yeah, I'm so proud of the work that you do. And Kelly, your leadership over time, you've been with the organization for...
Well, I've been the CEO since 2004, but it's been about 36 years that I've worked with the organization. So,
And Kelly is retiring at the end of this year, right?
Yep.
And so you, I know, have learned a lot about leading a very complex nonprofit organization over time. As you've seen Primary Healthcare grow and expand, what are some of your dreams and hopes for the future for this organization that you have helped build?
Yeah. I would say that those 40,000 patients that we serve, that has always been our driving force since the day we opened. There are people that need us in this community. It is hard work. Anybody who's working in a nonprofit, especially Safety Net Healthcare, it's hard work, but it's so necessary, and if we weren't here, 40,000 people probably wouldn't have access to care. And so I think that's what I'm most proud of is finding creative, innovative ways to continue to do that, even when financially it's hard. Stepping in when there are gaps in the community, and we have done that for 30-some years. I have complete confidence that the team will continue to do that into the future. And unfortunately, there aren't less needs. There's more needs. And so PHC, Primary Healthcare, just plays an incredibly important role, and the staff here are committed to the mission, and they do great work. And I'm super excited to see where they'll take us.
Yeah, well, do you see why I said we have a really amazing nonprofit sector, and certainly amazing nonprofit sector leadership? Kelly, thanks for all you've done, and thanks for making our community better together.
You're welcome. Thank you.